Welcome to the Notorious DID. I am Reed. I am going to be doing the second part of procrastination and medical procedures. So I am currently co-con with Solara. Solara and some of our other alters do suffer from procrastination, which can be a real issue with getting anything done or getting anywhere. Procrastination of medical treatment can really be a problem because that means that if it is something serious, then you are prolonging the situation. In some cases, you may be prolonging the disease to the point of where it is going to be debilitating or a problem for you down the line. I would personally say if you have procrastination, work toward getting past it. Work toward being more proactive and getting things done. Procrastination does not help anybody, and procrastination leads to problems down the line. The levels of procrastination may start at a bottom level and just work its way up right over your head. So, especially with medical procedures, and when there are other alters in place, there's not much some of us, like myself, can do about it if somebody's procrastinating and not getting things done. This particular procedure was procrastinated for over months, and there was no cause for it. When you are continuously just rescheduling, and there's this issue or that issue in your head, well, now some of it did have to do with the fact that we had the seizures. So yes, one of those appointments may have been rescheduled because of that, but the others were just rescheduled because of rescheduling and being nervous. So yesterday morning is when we had our skin tag removal procedure. This was done in office and was done in the morning. And I will walk you through the easy steps of what took place. Was I nervous? Because I myself, Reed, am who went to the procedure because it needed to be done. So Laura really just wanted to cancel it, which was not going to get us anywhere. But it wasn't something that absolutely had to be done to where we would die or not be able to make it through if it wasn't done. But it was something that had to be done. Skin tags can get infected. This was not known until it took place. So when a skin tag has gotten infected, it is a good idea to go and have it taken off. Skin tags, I found out yesterday, can also be cancerous or benign. Mine was benign, but they can also be cancerous. So if you happen to have a skin tag come up and you have any questions, do seek medical advice, seek medical treatment to find out what's going on, make sure that it's safe, even if you're not going to have it removed, at least so that you know. Because, as they say, knowing is half the battle. And that's very true. So I got up, got ready, was proactive, got out of the house, headed to the appointment, got to the appointment, and they got me in pretty quickly. This procedure was done with Tidelands, which is a medical group, I should say, down here, because they do have hospitals, they have individual doctors that are connected to one another. This was Tidelands surgical specialists, Dr. Gora, which is a very good doctor if you happen to be in the area of South Carolina down here at the coast in the Myrtle Beach region, then definitely check him out if you need any kind of surgery. He's also going to be doing the surgery for our daughter, which is keloids. I no doubt believe that he will do an excellent job because he did an excellent job with mine. So no matter what took place, the level of anxiety was still lifted. When you are COCON, okay, I have been mostly COCON with Solara. Solara can be very high strung, full of anxiety, and this affects the body no matter how the other alter, myself Reed, is going to be affected or not affected. So keep that in mind with people with DID. When you're COCON, that literally means there are two different parties with two different opinions, two different attitudes, two different physiological issues, mental issues, problems. So the way that one is reacting, the other is going to have to deal with. In this particular case, obviously because she had decided that she really didn't want to do the procedure and she kept procrastinating and prolonging it, then on her part, our blood pressure was sky high. Well, the body has had high blood pressure since we were 15, I believe, or around there, and almost always been on high blood pressure medication. But here recently, I do think we're going to have to change our blood pressure medication because it is not working as proper as it used to. And the last few times that we've been in, it has been high. This particular time, yesterday, when we went for the procedure, it was high, evidently extremely high. The nurse took a look and she's like, had this odd look on her face, and she says, "Do you normally have high blood pressure?" I'm like, "Yes, we do normally have high blood pressure and we're on high blood pressure medications." She's like, "Okay, did you take it this morning?" I was like, "Yes." So then she's like, "Well, I'll try the other arm." She switches it over to the other arm with the cup. It comes up evidently the same or higher. I don't know. She just acted really peculiar about it. Luckily, because Solara's like, "Well, oh my God, this is the." And I'm like, "Well, we're still getting it done. So suck it up and deal with it." Then the doctor comes in and the nurse says, "Look at this," for the doctor with the blood pressure. And he looks at it, looks a little odd, and then he says, "It'll be okay." He's probably thinking, "Nurse, do not stress this woman out. I have to do a medical procedure on her in a few minutes, and you need to get it together because I do not want her blood pressure any higher than it is right now." So I go, I sit on the seat, and they prepare me, and it did not take that long. The nurse came to the side and was holding my hand. I guess there are a lot of people that are big babies with needles and procedures and things of this matter. Have we kind of been a big baby? I'm guessing Solara's kind of been a big baby if you take into account that she's procrastinated so much with it. But me, not so much. When I go to have a shot, and when some of the other alters go to have a shot, if we hold our breath, we tend not to feel the pain. We tend not to feel as much of the problems. So literally, they're like, "Well, this is going to stick and burn." Of course it is. It's a shot. So they shot up the area, and it stuck, it burned, but it wasn't that bad. And the nurse was like, "Oh, you're doing so good." And I was just like, "Yeah, okay, let's just get this over with. I don't care." And doctor cuts off the skin tag in a fairly quick motion quickly after. I didn't feel anything, obviously, because it was numbed up from the shot, and the shot worked extremely fast. So Then he was originally going to put a suture on, but he said that it was a smaller situation and didn't really need a suture, but it did need glue. So they put glue on the wound. Once that was passed, he did say that I had to stay there for a little bit longer because I have blood thinner that I'm on. Okay, several years ago, 20 November of 2013, or I think it was November of 2013 or 14. I don't know, something like that. I had a pulmonary embolism, which originated from behind our left knee as a blood clot and went through into our left lung. Well, because they did not know the exact reasoning behind as to why we had a blood clot and thickening of our blood severely at that point, they put us on blood thinner, which is Xarelto. Excellent. If you have to be on blood thinner, I do recommend Xarelto. So I had to stop the Xarelto, obviously, because it is a blood thinner, several days prior to having the procedure, which I did. And he said that there was still excessive bleeding for the particular procedure and the size of the wound. So I did have to stay a little bit longer, but it did not entail a suture because he did not deem it necessary. He also put bandaging on it, of course, and that was it. That was it. Done and out. Do not have to go for a follow-up. Do not have to do anything else. Later on, within, I would say, a few hours, I guess, once the pain medication wore off, there was pain. Obviously, there's going to be, because a piece of your skin was cut off of your body. It is not going to be pleasant. Did not really expect it to be. But a couple of Tylenol, and that was good enough. So, I'm still on Tylenol for probably going to be a couple of days because it is a very, very sore spot. But, like I say, I do recommend if you have any procedures, any problems, any questions that you have mentally or medically, proactively seek advice and treatment, because we do not want these things getting out of hand. Okay, I am being told I am long-winded, despite the fact that I talk fast. So, thank you for joining the Notorious DID. So, like, share, subscribe, hit the notification bell so that you can join us on our DID journey and learn more as we learn more about ourselves and the disorder. This has been Reed, and thank you for visiting. Peace.